Sickle cell disease is a blood disorder that's inherited and affects approximately 100,000 Americans, primarily of African descent.
Sickle means that the red cells are not in the forms that they're supposed to be. But that in itself is not a problem. The problems come the fact that those dysmorphic cells are not able to carry oxygen as adequately. A crisis is the representation of the fact that part of the tissue is not receiving oxygen anymore because the vessel is blocked. Sometimes part of that tissue will be reinfused by blood and will gain back its capacity, but sometimes part of the tissue will not go back to normal. So it can cause damaged tissue, scarring tissue, and that tissue over time will lead to either chronic pain or failure of the organ in which this infarct is happening.
The process of a myocardial infarction or a heart attack is basically an organ not getting the oxygen that it needs. When that happens in an individual living with sickle cell disease and it occurs in a muscle bed or a bone, that results in pain. When it occurs in the lung, that results in a process called acute chest syndrome. When it occurs in the brain, that leads to a stroke. So it is not a large leap to understand that the underlying pathophysiology of some of the ischemia associated with an MI could be related to the ischemia associated with an acute painful event.
Sickle cell patient is a population of patients with chronic diseases, and we can say that there are about 2 or 3 major unmet medical needs. First, to be recognized as a chronic disease for which there needs to be a lot of research. And the second one, probably addressing the elements that are associated with the stigma of this disease. So that's a disease associated with a race. It's not like that. It's really a disease that affects many different types of races. And we need to address this population with larger number of trials and significant number of new agents to treat this disease.